Welcome back to 90.7 Perspectives on WVAS. Robb Taylor in on this Wednesday evening. Thank you so very much for tuning in. Dr. Lane Rowling has joined us before several times, and tonight we thought we'd spend a little bit more time with him tonight. And he is an infectious disease expert, and he keeps it 100. I mean, he just lays it out there. So that you can get it, and he's straight up honest with you about it. So we're going to talk with him tonight about COVID-19 once again, and that's the coronavirus, the Omicron, and all of the things in between. Dr. Lane Rowling joins us via telephone. Dr. Rowling, thank you so much for giving us a call tonight.
Oh, thank you for having me on your program. Super fantastic.
Dr. Rowling, I have to ask, is this COVID pandemic anywhere near over?
Oh, absolutely not. We're looking at least another probably 10 to 15 years of this going on at the pace we're going, and especially what happened over the last 24 hours. Now we know that there's a new Omicron mutation coming down off of the Omicron. So this is going to get a little bit more serious before it gets a little bit better.
Wow. You said it's going to get a bit more serious, then it gets better. Well, let me ask you this: has the Omicron, has it reached its peak yet?
No, it hasn't reached its peak. We're probably looking at probably another 6 weeks to get that maximal curve. But the reality is that the Omicron is so infectious, it's affecting everybody. This is a game changer in the world of virology, just because of the fact the virus has all these 50-plus mutations. It's not just affecting an individual, it's affecting a whole household. The testing is being inadequate because the vast majority of the testing can't even pick up the virus because of the Omicron BA.2 stealth capability of the virus.
Wow. I think I heard an interview you did with an Atlanta radio station, and you said this virus, talking about the coronavirus, this virus is an emerging virus and has been around since the 60s?
Yeah, no, when we look at the COVID-19 virus, this virus is what we call an emerging virus. The first documented case in Western time was in 1964, when we had the capabilities to identify it through electron microscope. But when we look at the coronavirus infection itself, this happened 20,000 years ago. And what's happened is that this virus has figured out what we call virulent effectiveness. It's figured out how to jump from an animal into a human being. It's being able to change itself because of the capabilities of it being the largest RNA virus. And this is the reality.
So, and you say this virus is going to be around for another 5 to 10 years. So, what can we? I mean, so is this the new norm for us? I mean, we're going to have to just deal with it.
Well, this is the reality. We have to set the clock back. This is our new norm. I mean, I've been telling you folks for the last 2 years what was going to happen. You know, we initially started off with the alpha strain, the beta strain, the gamma strain. These viruses were direct off the Wuhan strain, which is an animal model, and the virus jumped from an animal into a human being. The problem now that we have is that with these new variants, especially the Omicron and the IH2 out of South Africa and France, now we're getting what we call viral evolution in a human being. What does that mean? You have somebody's HIV compromised, somebody's immunocompromised with cancer, or some type of autoimmune disease, and they're taking a immunosuppressive medication. That virus gets into the body. The body cannot mount a proper immune reaction to it. That virus gets the opportunity to see all the immune defenses, the adaptive immune system, the innate immune system, and the body cannot adequately get rid of the virus. So as that virus is living in that human being, that virus is going to change, modification. If you add a vaccine in that's supposed to neutralize that, and the vaccine's not 100% effectiveness, you're going to leave 5-10% of the viruses alive, and they're going to mutate. Same thing if you have a person like the Omicron, which originated in a 36-year-old black female AIDS patient who didn't get any antiretroviral medication. The virus was in her body for 216 days. That virus changed. It mutated. And this is an evolution advantage of the virus. So now what we're getting now with the Omicron, IHU, Omicron mutation coming down the road is that these viruses are now coming from human to human transmission versus coming from an animal to a man transmission versus the alpha, beta, and gamma. So this is a game changer. And this is why these viruses have more mutation, much more evasive in the immune, innate and adaptive immune system, still capabilities, higher transmissibility, and very, very infectious.
And this Omicron, it rapidly spread, seems like in just a matter of weeks.
Yeah, and I told you guys what was going to happen a month ago. And once again, when you really deal with this stuff in the real world, you understand virology, you understand infectious diseases. And this is exactly what was going to happen. Now, the argument would be, man, the Omicron hasn't killed anybody. Well, it's killing people. The numbers will come out in the next 2 or 3 weeks. We already know that it's more infectious. And so what do we mean by infectious? People think that sometimes a great virus is the one that ends up killing everybody. Well, Ebola is the guru of killing people in a village. Very efficient, but very awful as a sustain of its evolution genetics. It goes away. The Omicron has downgraded itself to be able to affect more people, which gives us much more survivability, much more capabilities, and that's the object of the virus, is to stay alive. So if you downgrade the symptoms, you don't get the headache, the fever, maybe get a cough. Instead of just affecting one individual that has a full-blown immune system reaction, now what's happening is that, hey, you got a cold, you go home. I just got a cold, runny nose, I'm no big deal. Well, you affect mama, big mama, grandmother, the children, the whole thing. So now what we're seeing is household infections, which gives it more capabilities. Or i.e., you're at the standing in the line to get tested, and somebody coughs. It affects everybody. So this virus has much more transmissibility, much more effectivity, and it came out today that the boosters and the vaccine has no effect on the Omicron, period. That ballgame's over with.
Wow. This is 90.7 Perspectives on WVAS. Robb Taylor in on this Wednesday. On the phone line with us is Dr. Lane Rowling, infectious disease expert. Of course, we're talking about the coronavirus. Not that long ago, which I think was during the summer, we were dealing with the Delta variant. And now here we're talking about the Omicron. What is the difference between the Delta and the Omicron?
Well, the main difference is that the Delta is a lineage off of the Wuhan ancestral virus itself. But the Delta only has 13 mutations. The Omicron is a evolutionary off of an immunocompromised patient, and this virus has 50 plus mutations, 30 plus mutations in the spike protein, 10 mutations in the receptor binding domain, which gives it way, way greater capabilities. In fact, there are two Omicrons, Omicron BA1 and BA2, and BA2 has stealth capabilities where you cannot pick it up on testing. That's why the virus is really out of control, because the testing that are out there, ELISA are not picking it up. So people are going to get tested, and they're coming back negative. So that's why you have to do serial testing, at least 3 or 4 testing over 10 days, because you will serial convert eventually. PCR will pick it up 14 days later, but that just tells that you have the genetic material. So the Omicron is 100 times more infectious, has 70% more cells in the viruses in the cell, causes a bigger infection, and it's a ballgame changer.
President Biden held his press conference, and he said, yes, the nation is weary from COVID, but the U.S. is in a better place. You say what to that?
Oh, that's absolutely a bonkers. That's just political noise. We're in the most terrible situation because schools are closing down. Cruise ships are super spreader events. You have restaurants are closing down. We have people are sick. Hospitalizations are way out of the roof, more than ever any time in the history of the last 2 years. So that's just a bunch of political noise. The political noise doesn't represent what's on the ground, because there are thousands and millions of people are sick right now. And this is why when you try to put a political situation into a science world, you're going to lose. That's why you have to make sure you understand what you're talking about. When I was on the Roland Martin show last night, they asked me, what would you do, Dr. Roland, if you were in charge? Well, I've been trying to do this for 2 years. You have to have that big mama conversation where you sit down and say, folks, this is a national emergency. This is a virus, RNA virus, coronavirus, transmitted through respiration, secretions, and fecal matter. Folks, this is a treatment. This is how we need to get through this. Folks, you have to protect yourself with this particular technology. Folks, this is the testing that you have to have, etc. We did not have that big mama conversation, and people jumped into the lane. So, and we already know the results because you can look at the numbers. We're almost up to 900,000 Americans have died. So that's your grade. You failed. Your policy's not working.
And so many people are still not taking this serious. And it bothers the rest of us who are taking it serious, and we're wearing our mask, and we're washing our hands, and yet then we walk into a grocery store or a department store, and there are people everywhere with no mask on. There are people at football games, basketball games, they're not wearing a mask, and it bothers the rest of us. So
the reality. Sorry.
Go ahead.
No, I'm saying the reality, that is the narrative. And that's the non-complacency, because you don't have a uniform policy. You can't have 50% of the country not wear a mask, 50% wear a mask. You can't have vaccines that are not effective, and half the people get vaccines, don't get vaccines. It doesn't make any sense for an individual to get vaccinated and still get the infection and die. For example, when we look at a cruise ship as the ultimate petri dish, everybody's negative before they get on a cruise ship, everybody's vaccinated, and they still get a breakout. Your vaccine is ineffective, doesn't work. And so what happens is that people got this thing, when it comes to viruses in this pandemic, endemic infection, people are mentally tired. Well, I'm tired of talking about it. I just want to go back in the jungles and operate on babies and stuff. But the reality is that we're mentally fatigued, and this is an end in no sight. There is no solution because we don't have a uniform solution. People are trying to piece it together by putting Band-Aids on a leaking dam, and it's not going to work. We're going to have a 360-degree turnaround, a national dialogue to make sure that we're doing it right. As a member of the Congressional Healthcare Task Force, and I was talking on a meeting, Zoom call a week ago, we have lost a generation of people through education, children, homeless, increased violence, economic insecurity, food insecurity. We have lost. And at the rate we're going, we're going to lose another generation because of the inequities and healthcare disparities. Also the fact that, in rural Alabama, people don't have internet. People don't have even proper water. People don't even have proper insight to healthcare. As a member of the Urban League, Arkansas branch, helping the rural America, I know. I'm in the bush. People are not going to Big Mama's trailer house and talking to her about the virus. So this is a new narrative, what we have to do and set this clock back. If not, we're going to be doing this for the next 50-plus years. That's a fact.
Now, the Biden administration says, hey, you can go online and order your COVID test to be delivered to your home. Was that a step in the right direction? And they're free of charge?
Well, absolutely not. What is the upside to that? So you send a test to Big Mama's house in the rural Huntsville, Alabama. She's been infected for 4 or 5 days. She's already super spread the infection to everybody. You get the test out, then what? What's the solution to the problem? Oh, you get tested positive, you go into quarantine, we give you dexamethasone. What is your long-term strategy? And that doesn't work. So if you're going to talk about testing, what is the significant upgain to testing individuals? It's a lot more than just testing individuals. When you test them the day they get sick, is it 3 days later? Has somebody in their family been infected? What is the outcome? What is the contact tracing on that? How do you know? What is the long-term goal? And right now, you're just doing, it's like me taking darts and going at a dartboard at night, hoping you hit the target. And that's not going to work. In fact, it's going to really exacerbate the whole situation because we don't have a uniform policy. What is the solution to the testing? What are you looking for?
How long does it take to recover from COVID-19?
Man, that range can be anywhere from 2 days, 3 days, up to a year, depending on the severity of the infection, which is viral load, how many tissues were infected. The thing about coronavirus and Omicron that makes this virus different than all other viruses from Ebola, dengue, etc., rabies, polio, this virus has what we call multitropism. What does that mean? This virus can affect every tissue in your body. So you can have every possible complication, long-haul syndrome, eyesight problems, nervous problems, mental fog, chemical brain, become a diabetic, erectile dysfunction, chronic gastrointestinal problems, versus something like the flu, which has tropism just sort of making for the lung. You can get a lung infection, that's it. The coronavirus can have every possible symptom from skin diseases to brain because it has the multifunctional ability to affect every cell in the body. And so we talk about what is the infection rate, very high. What is the long-term consequences? Nobody really knows. Every individual is different. Maybe you go to a store and you breathe in the virus through your nose. Maybe you don't get any smell. Maybe I breathe it through my lungs and get a big infection through my lungs and heart, and I end up dying from pneumonia and cardiovascular. Maybe I'm one of these people that get infected and the virus goes to my pancreas, kills the islet cells, and I become a diabetic. So nobody really knows that, and this is why we're still so early in the COVID pandemic, understanding the syndrome and the long-term infection rate.
Let's talk safety here a little bit. Let's say, for example, hey, I don't want COVID. Can I go into a drugstore and buy something over the counter that will kind of help me as far as not contracting COVID? Are there vitamins or supplements or things in there that could help my immune system, my body, fight off some of the symptoms?
Yeah, I mean, I recommend everybody should have a great diet. I think everybody should take multivitamins. But I would argue that probably the most dangerous place to go is the pharmacy. Contaminated viruses everywhere. So you have a bigger chance of being exposed. You can order stuff off the internet. You can order multivitamins. You can look at TopedaBiosecurity.com and get your air purification unit, get antiviral masks, get antiseptic hand wash. You can get all this stuff online, which decreases your chance of being exposed. But yeah, average day individuals should take a multivitamin, have a positive attitude, great diet, exercise, and have situational awareness, because we're in this for a long haul. If you really think this is a game, you watch what happens when you go to Kroger's or Walmart, and you go into the food section, you look at people getting produce. People are spitting, they're coughing, they're hacking, they're breathing on your bananas, they're infected. People that have vaccines that are super spreaders of the infection now, and you take that produce home. Make sure you disinfect your produce when you get home. Make sure you don't wear your shoes in the house. Make sure you don't touch anything in the public arena like kiosk machines at Wells Fargo or PM machines at ATM or the gas pump handle, because they're all contaminated with feces.
So should we just wear gloves all the time? Because, a lot of us touch the ATM, the key fob, and all these other things, the kiosk, I should say, and all these other things, because we're not thinking, I should have some gloves with me.
Well, my recommendation is what we call situational awareness. Protect your hands. I don't care if you wear gloves or you got to get touch pads or even get hydrosol viral spray to spray things down before you touch them. Hell, even use a paper towel, with a plastic bag to pump the gas handle is better than having any contact with this space. You have to realize that probably the three ways that the virus is transmitted through respiration, through secretions, and contact. Contact is probably the hugest one, just because of fecal transmission. That's why when you look at Walmart, so you go to the airport's bathrooms are fecal contaminated. And that is why we have to understand that and educate people. When we discovered the Omicron variant in South Africa and in California, guess how we discovered it? We discovered it in the feces. It's called sewer surveillance. Every sewage municipality in the United States is infected with the Omicron virus and coronavirus. And as we go through this process and we get better as a healthy society, the virus is going to go away. So if the virus is in feces and all the sewages, you can imagine what's happening on the cart handle at Walmart. You can imagine taking your finger and putting your PIN number at a Wells Fargo ATM machine. It's infected, so protect your hands, and that's a very important thing for decreased transmission.
Our hospitals, every night I watch the news, I see where the hospitals across the U.S. are just bombarded with patients dealing with COVID, and it has gotten to the point where some of our staff at hospitals, they're quitting their jobs, saying we can't do it. It's just too much. What's your take on when it comes to the hospitals and the number of patients and then the number of staff members that hospitals are losing?
Well, the reality is that this goes back to what are you getting in the business for? You got in the business to help people. It's your job. Toughen it up and take responsibility. That's what you went into healthcare for. That's what you went to medical school or nurses. I don't want to hear any excuses about that. I don't care if you got 1,000 patients, you take care of them with the best of your humanity. But also goes to show you that the lack of knowledge in some of the doctors and healthcare staff, because they don't understand they're dealing with a very infectious virus. This is a ball game changer. That is the reality. And guess what? At the end of the day, doctors and medical people are human beings too. They die also. So they need to make sure, one thing is to talk about telling a patient to do this and that, but you also have to live it yourself. They need to make sure they wash their hands. They need to make sure they follow the rules. They need to make sure they're tested. They need to make sure they got the proper mask. And this is the burden of being in the healthcare profession, humanity 101. You're here to save lives, so just get it done. If this wasn't a profession for you, you shouldn't be in this profession. That's what we trained for many, many years, to be able to be here for the moment, not when it's, tea time. And sometimes you got to roll your sleeves up and it's hot chocolate time.
The booster shot. I know you told me some time ago that you're like, hey, I'm not getting the shot. But now we're at where people are getting booster shots and people need to get the booster shot. I got to ask you your thoughts again on the shots, but in particular the booster shots.
Well, I published that today. It shows you that the Israeli study came out, the booster shot has no effect. And that's just the reality on the Omicron. The Omicron changed the whole ball game. There might have been a little bit of hope and aspiration with the alpha and beta, but all that's been dashed away, and it's proven in science now. So if you believe in booster shots, like I've always said, go get your neutralizing antibodies. I'm on the Black AIDS Institute. We have a marker for AIDS patient called the CD4. I know if a CD4 cell is high in an HIV patient, over 10 to 15 years, that number goes down. That is your marker. Well, in the vaccine world, especially when it comes to COVID, the marker is your neutralizing antibodies. So what you're going to have to do is get your neutralizing antibodies and find out what that level is. Maybe you're getting a placebo. Maybe you don't know. But the reality is that you have to have that number. So if you get a booster shot, you better get your numbers. Because I can tell you right now, like I've said before, you will be getting 3 or 4 boosters for the next 50 years. And there will have to be a vaccine booster for each new variant. Alpha strain, beta strain, gamma strain, Megatron, Begatron, Star Trek, whatever booster they're going to come down the road, you will be getting.
So there are going to be other variants out there that we are going to have to deal with. That's what you're telling me.
Oh, absolutely. It's IHU right now, and we know that there's another strain coming in the next month called the Omicron variant, which is a variant of the Omicron out of South Africa also.
Wow. Ooh. Dr. Fauci, he predicts that most states will be past Omicron the Omicron peak by mid-February. You know, it'll be behind us. What do you say to that?
And Dr. Fauci told you we'll be back to normal last Christmas too.
So, you know, he's been under attack here lately. We saw what happened on Capitol Hill with him and some of the lawmakers on Capitol Hill. But the Biden administration still believes in Dr. Fauci and what he has to say.
Well, talk to me about a year when elections have started coming around. We'll see that noise is going to go right out the window.
I have to go back to people not just being safe, and you know, you just don't know. You don't want to say anything to anybody. But I think it all goes back to what you said earlier, the uniform policy. You know, because when I go to that grocery store, and I'm like, I just cannot believe all the people in the grocery store, they don't have on a mask. I see more African Americans with a mask on, but not many of the other races. And I guess these people just don't care. They don't believe.
Yeah, I know what you're talking about. I'm very fortunate and been blessed by God to have the opportunity to have the international life and the travel I do. And I've been in rural Mississippi and Arkansas, and them country boys in their stores are not going to wear their damn mask because it's their constitutional right. And they don't have a constitutional right to infect other people. But you have to understand some of these states like Alabama, GOP, you have Arkansas, have really set the black and community back another 20 years because of the ineffective policy. There is no excuse for not wearing a mask with a respiratory disease. It became a political issue, and guess what? Just like the state of Mississippi, ball game over with. You're a super spreader state, and you're going to be dealing with this for a long, long time. The consequences of inaccurate policies and procedures that should have been articulated to save people's lives, and not for some political expedient solution.
Yeah, you're right. It has become a political issue. And when we heard, no mask mandates, you could hear people literally cheering, no mask mandates. Yeah, you can't make me wear a mask. So I'm not going to wear a mask.
I would argue right now that always the devil is in the pudding. I want to see some of these folks that don't wear a mask. I would like to talk to them because I talk to thousands of people every month, hospitals, patients. I'm saying, how did you survive COVID? And I guarantee you, most of them felt like they were going to die, and a lot of them are going to die. So if you want to play that game, play with your own health, because COVID is going to dictate what's going to happen. And a lot of folks are not going to make it to 2023.
All right, so Dr. Rowling, in these last few minutes we have here, what else would you like to share with the public as far as being safe and doing the right thing and just, taking care of yourself and the virus in general?
No, I think the reality is that they need to make sure people are getting the best information, not disinformation, and not base things off of feel good. When you do stuff off of feel good, that's when you get yourself injured or get yourself killed. So you need to make sure you're following people that actually have training in infectious diseases. We're not talking about somebody that reads a book or drinks a Starbucks coffee from, South Alabama. You better look at people and see if they've been in the field, actually really treated viruses, teach viruses, understand viruses, look at viruses under the microscope, how it really works in the real world. And at the end of the day, the reality is that it's going to come down to one thing, going back to the basic biosafety suite of protocols. Wear a damn mask, vaccinated, unvaccinated, wash your hands, don't wear your shoes in the house. Keep informed on what's going on. You put your head in the sand, you're not going to see. And you might not see 2023 because this virus is going to kick up more. It's going to get worse. And the new mutations are coming down the pipeline. Don't be surprised in 1 month, we're doing a call again that the next virus has 75 different mutations. This is our new norm. And so you have to be able to navigate in this new world. The baseline. What is the baseline? This is your baseline. You're going to have to get your technology. You're going to have to figure out how to go to school. You're going to have to figure out how to go to the market. You're going to have to navigate But your days of going back to what it was 3 years ago, that ball game's over. So we have to have a mental setback to achieve a certain level. We have to have a mental capabilities to function in the environment. We have to have technology to function in the environment. We got to make sure we protect our children and get our children back to school, because we're going to lose a whole bunch of generation. When I was on the COVID Healthcare Task Force last week with G.A. Carmichael, my boss, COVID Healthcare Congressional Black Caucus International, we talked about that. Whole generations are lost, economics, etc. We're going to have to reset that clock back and have that big mama conversation if we're going to be able to move in the future and understand what viruses really are and not a political field right now.
Early on, you mentioned antiviral mask and antiviral sanitizer. Where is the best place to find? I mean, can I go into my department store, grocery store, and find this, or to a Walgreens or CVS or something, or where's the best place to find it?
You're going to have to go to TapedaBiosecurity.com. TapedaBiosecurity.com, which is the
spell that out for me. Spell that out for me.
Tapeda would be TapedaBiosecurity.com. TapedaBiosecurity.com. And we have all the technology in the world, and that's what we use at the different universities that we implemented on different campuses in the United States, from air purification unit to providing the students antiviral masks on campus and even spraying campus form.
Wow. You always give such rich information, and you just do an outstanding job, and I really appreciate you taking time to talk with me again tonight. And we keep your number locked in, because like you said, you wouldn't be surprised if a month from now we're doing another interview, and we will. Well,
I wanted to thank you for even giving me the opportunity to be on your program. I'm just a humble servant, a guy that worked in the jungles, from the Louisiana dirt to the jungles of the Amazon with my muddy boots and wet boots and heavy backpacks. And it's just an honor to be in this stage for the last 2 years at the level I'm at, from all the programs, from Roland Martin, MSNBC, Black News Channel, your beautiful program. It's been a pleasure for me to be able to spend the years I've done, 30-plus years of real work, to be able to come back and help people in the United States and save people's lives.
Dr. Lane Rolling, infectious disease expert, thank you so very much. And Dr. Rolling, of course, we will definitely be in touch.
Good night, folks. Take care, Alabama. Bye-bye.
Bye-bye. That's Dr. Lane Rolling, my guest tonight on 90.7 Perspectives. I always got just rich and detailed information to pass on regarding the coronavirus, and we really appreciate Dr. Lane Rolling. All right, before we wrap up tonight, I want to say thanks again to Philip Ensler for joining us, getting things started for us here tonight on Perspectives. Keep in mind, he is a candidate for the Alabama legislature. He's running for the House District 74 seat in the Alabama legislature. I want to make sure I get that right. Yes, that is the House District 74 seat in the Alabama legislature. I think he said the primary for that race is coming up in the month of May. And again, thanks to Dr. Lane Rolling for sharing great information regarding the coronavirus. Like you said, folks, you got to stay safe out there. Wear your mask and make sure you wash your hands. Whatever it takes, you got to do it to make sure you stay safe. All right. Kevin, I think that's going to do it for tonight's edition of 90.7 Perspectives. To our listening audience out there, thanks so much for tuning in. Thanks so much for listening. Make sure you stay safe. I'm Robb Taylor. We'll talk again next time.